Hello, Jokers. Thanks for watching this episode of Jokers Physiotherapy. Today, I wanted to share with you this relationship and what we can do about it, the exercises to help. Now, there is a strong link between dry mouth and grinding at night. And grinding, obviously, when it's repeated over time for a very long time, sleep can be many hours, and repeated every day, it can obviously have an impact on the jaw joint. So, upper lips, when they're too short, it can actually affect the seal of your mouth shut. Now, at rest, where your tongue sits should be at the roof of your mouth, as many of the professionals may have already advised you. So to keep it at top of your, on the alveolar ridge, which is just at the top, where the hard palate, where the front teeth come down at the edge. Now, Roccabato, who's posed this, and it's obviously in his training program, describes it so that the lips need to be properly sealed, so you can keep your tongue on the top and keep it there. Now, in order to keep it there, you need a negative pressure within the mouth, and the sealing by the lips are very important. Now, the fact is, in a normal case, that's possible, but in some people with a short upper lip, normally the upper lip should cover at least 75% of your upper front teeth. In my case, it's probably covering that, and the rest, 25%, is caught up by the bottom lip going up that way. But in people who are shorter lips, whether it be because it's muscle being tight here or things like that, it needs to be stout. So I wanted to go through some stretching program, and then we can the way we keep it there. And in another video, we will do training to strengthen the muscles around the lips. Okay, so the suction is important, and for that we need an upper lip. If it was short, needs to be lengthened out. By the way, there's a big word for the mouth is xerostomia. All right. So you need a clean pair of thumbs, clean index finger also. Actually, the thumbs, you need to wash your hands. I have washed my hands, and you need to put your thumb behind the upper lip from inside. So your thumb goes inside, the index fingers grab it from the front, and then pull it down for 10 seconds. Hold it for 10 seconds, and repeat that 6 times, several times per day. Try and do it before meal or like that. So at least 3 times a day. So let's have a go. So grab it as high up as possible. Index finger opposing your thumb. 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can also hold it this way and pull it down. I am doing it this way, whichever works for you. You do that 6 times, at least 3 sessions per day. Now, let's say you've done those, and in between sessions, what happens? Because it's so tight, it may tighten up again. So in order to keep the gains, I'd suggest grab one of those, the ladies, the females tend to use the cotton to moisturize or to wipe down some facial cream or whatever. If you can grab those cotton buds from the pharmacy and you roll it out, so it lengthens out to this about that much, and you can fold it into 2, let's say with this cotton bud, fold it into two, and you obviously wet it. You wet this, yes, thin it out, and then insert it into where you've stretched. So where you had your thumb in there. So you got it out there. So that kind of stretched. Now, obviously, sorry, I'll take this out now so I can speak. So you don't want to be wearing this in front of a stranger. So obviously, this is something you do at home. Now, obviously, we don't want to cause massive stretch after you've done your manual stretch, but you want to maintain some. So it needs to be a gentle stretch and needs to be done for a long time. So we're talking like a couple of hours a day, like 4 hours is one book suggests. Well, longer the better. If you obviously when it's tighter, you don't want to be pulling so hard. You want to be doing it consistently, but in order to maintain the gain, we call it carryover effect. We want to maintain them, so use soft cotton, but keep them for a long period. So I hope this was helpful, and make sure you again use a clean thumb, clean index finger, wash them beforehand, and grab it from behind, underneath, go right up, and then pull it down. Hold it for 10 seconds, repeat 6 times in one session, and repeat that at least 3 sessions per day until you feel you've got a good seal of your lips so your tongue can stay up there and keeping your mouth from drying up, because there is a strong link to that and grinding, which causes obviously tightness when you especially wake up in the morning, or obviously if it gets worse, it can crack your teeth, wear down your teeth. Your dentist will be able to tell you that. But they are the solutions to one of the solutions to change what's been happening. Often this is a chronic condition, and it requires your effort and my sort of effort, which is like a physiotherapy. But it'll be very, very good if we can get this condition under control. I'm sure you would, and I see a lot of people struggling with this sort of condition, and I feel this will be one of a very easy way to do it. So hopefully this was helpful. Now, if you found this helpful, please give us a thumbs up or subscribe so for more videos about TMJ and its care. And in the next video, I would like to go through a quick and easy way to start strengthening the muscles around the lips so you can keep a tight seal. You don't have to be tight, but a good seal to keep your mouth closed with your teeth apart, obviously in a relaxed state, so you're not grinding or clenching through the day either. Okay, thanks for watching and happy rehab. Cheers.